Okay.
Dr. Dan.
Yes.
How are you? Okay. Here's some questions for you. A lot of people want to know, are you a chiropractor?
I am.
You are?
With advanced training.
Okay.
Not many people know that all chiropractors are not the same. That there's over 200 different techniques in chiropractic, and because a person has been to one chiropractor and not had the best experience, doesn't mean that they have found the right chiropractor for them, for their needs.
So can you tell us all about what's different about your chiropractic care?
It's a totally different set of techniques than we've experienced in New Zealand, and based on the latest research in the States. It has to do with resetting that part of the brain that's telling your muscles to be tight, and it also has to do with correcting posture.
Okay, so what are the main treatments that you offer for people in pain?
Basically the treatments we just discussed. Say often, without getting into too much detail, when a person has had an injury, a part of their brain wakes up and tightens all the muscles around the injury and never lets go. And until you have updated the brain, which is telling the muscles to be tight, you can have 100 massages and it will not tell the muscles to relax from the level of the brain. Until you have gotten the brain to tell the muscle to relax, you're basically going around in circles, which is the common story for a lot of our patients who've tried chiropractic, physio, osteopathy, and massage.
Okay. I think you've described a little bit about how the treatments work, but is there anything you want to add?
Well, more complicated cases, a person will have scar tissue inside their spinal canal, and I need some models to demonstrate what happens when that happens. We're following up on the research of a European surgeon named Alf Brieg, who had dissected a number of cadavers and moved the different parts of the body, such as the head and the legs and the pelvis, and observed for himself how the spinal cord moves inside the bony canal of the spine, and made a number of discoveries that to this day are still valid. A chiropractor in California was in regular communication with Dr. Brieg, and they collaborated to develop a technique whereby a person could break up the scar tissue with using a special series of stretches, especially to the neck, to relieve the scar tissue that has accumulated from an old injury. Because in your spinal cord, spinal canal, and the covering of the spinal canal, the covering of the spinal cord is called the dura. A person's had if you've heard of an epidural, right?
Yeah.
An epidural is when they puncture that tough covering of the spinal cord with a needle and inject something to numb the spinal cord itself. Well, the spinal cord is protected by a very tough covering, and dura, as in durable, that covering can get damaged in an accident, such as an auto accident, falling off a horse, falling off a bicycle, anything that would knock your head forward. And what happens is it scars just like any other part of your body. Like if you cut your skin, it would heal with the scar. Well, scar tissue is very sticky, and what ends up happening is that inside your spinal canal, where you cannot see it, you get this accumulated scar tissue that prevents the spinal cord and its covering from gliding properly inside the spine itself. And that shuts down normal function of the spine and also irritates nerves. And when the nerves get irritated, the different parts of your body don't work right. For instance, a person may have numbness and tingling down the arm and think that the problem is in their arm, when in fact it's further up and often in the neck. And we actually have a chart that could help indicate which nerve it is in your neck to correspond with the different fingers. This finger and this finger is one particular nerve. This half of this finger and this finger is another nerve, and these two fingers represent yet another nerve. And so a person may complain that they have pain on the arm, and what they really have is nerve irritation near the spinal cord.
What do you like best about your job?
What I like best about my job is to watch people get their lives back, become free. Living in a body of pain is like living in a prison. And I've had that explained to me by several patients who say, I wish I could just remove my head and get a new head. Or I wish they could genetically clone me and give me a new body so I could get rid of this one, because it's constantly in pain. My first patient in New Zealand had been to 50 different doctors of all types, supposedly seeing the best and the brightest, but to no avail. And after several months of treatment, is pain-free for the first time in 14 years because of this work. So that to me is very rewarding, to watch people get their lives back.
Thank you very much, Dan.
You're welcome.